Well, thanks for joining me this week. Last week we talked about magnesium, and I've heard a lot of buzz from the people who have watched the class and those who attended the class while it was live. There's a large need in the body for magnesium, but this week we're going to talk about iodine. Iodine is one of those that I feel very safe in saying that everyone needs to be supplementing with this very essential mineral. So we're going to go over the basics of minerals again, just in case this is the first of my mineral classes that you're watching. Minerals are basic constituents of all matter. They are part of living tissue and they exist in their inorganic form in the earth. Approximately 4 to 5% of our body weight is mineral matter, and most of that is found in the skeleton. Now, minerals are also present in tissue proteins, as well as in enzymes, blood, some vitamins, and so on. Minerals play a large role in our lives, even though we don't need very much of them. Your macro minerals are calcium, phosphorus, potassium, sulfur, chloride, sodium, magnesium, and silicon. So these realistically will be the ones that you need in a greater amount than the micro minerals, which are also known as trace minerals. So the trace minerals are iron, zinc, copper, cobalt, iodine, manganese, chromium, molybdenum. I hope I'm pronouncing that right. I need to go find a phonetic pronunciation for it. And then selenium. Although our body can make some vitamins, we do not have the ability to make minerals. So if our mineral nutrient is not contained in the soil, it will not be in the food that is grown there, and therefore will not be coming into our bodies through the foods that we eat. So we're going to have to supplement. A mineral is considered essential if deficiency symptoms are seen when it is lacking in the diet, and the symptoms resolve when it is resupplied. Okay, iodine is one such mineral. It is considered an essential micromineral. Here's what Dr. Mark Serkis has to say in his book, Iodine, Bringing Back the Universal Medicine. Very good book to read. He says, it is not a good time to be caught like deer in the headlights, nor have our heads stuck in the sand about iodine or anything else that affects our survival and the health of our children. And this statement is brought about because we are living in a radioactive time of history. And iodine is a mineral that protects every cell of your body from radiation poisoning. So the role of iodine in the body goes far beyond its function of making thyroid hormones. This is what your medical doctors and the quote-unquote medical authorities would like for you to believe, that iodine only feeds the thyroid. Iodine is related to the ability to resist disease. We all need iodine to survive. It is essential for human physiology, so our health is dependent on its presence in sufficient quantities. This is again from a quote from the book by Dr. Mark Serkis. And here's another one. It is also necessary in a very broad sense to help protect the body from falling down in the face of all the different types of radiation. It will help the body not fall so easily into cancer, metabolic syndrome, diabetes, or heart disease. Iodine is that important, and that is one of the reasons it still survives as a very popular supplement despite reasonably intense campaigns from pharmaceutical medicine against its use. Okay, so I included this because some of you will talk to your medical doctors, and your medical doctors will tell you that in the doses that I'm going to say are recommended for the body, they're going to tell you that those dosages are harmful, but they're not. And we've known that for a very long time. So what does iodine do for the body? This is just part of the list, okay? I think we have another page over here. Yep, there's another page. So let's get started here. It protects the body from radiation poisoning. Sufficient cellular amounts combat radioactive iodine. Disease resistance. It helps to eliminate goiter. Aids in the production of thyroid hormone. It kills most bacteria, fungus, yeast, and viruses on contact. Prevents and cures breast cancer. Diminishes all forms of cancer by by using it in a concentrated form. Aids with fatigue, foggy brain, problems with concentrating. So if you suspect you have ADD, ADHD, you are deficient in iodine. It helps to create a safety buffer against toxic medicals. Okay, and this is true of all the essential minerals. It helps to eliminate and perhaps only in some people minimize diabetes. Specific protective effects against fluoride and bromide, we're going to talk about those a little bit later. Helps eliminate lead and mercury from the body. If you suspect that you are having some symptoms of lead or mercury poisoning, you need iodine. Iodine is a crucial antioxidant and apoptosis inductor with anti-tumoral and anti-atherosclerotic activity. I practiced that word over and over again. I still got it wrong. Protects the body from fibrocystic breast disease. Okay, this is the beginning of breast cancer. Protects against breast deformation and protects against general calcifications. Don't you hate it when people misspell something? Okay, thyroxine is a thyroid hormone, and it consists of 65% iodine. Your basal metabolic rate is how your body determines how it's going to use energy. So if your basal metabolic rate is low, then you have low or slow metabolism. Okay? So that's another sign of iodine deficiency. It aids with cell respiration, energy production, increases oxygen consumption, aids with general metabolism. It aids with normal growth and development, protein synthesis, energy metabolism. It influences all bodily functions. It aids with nerve and bone formation. Okay, it's necessary for the reproductive system. It aids with the condition of your skin, hair, nails, and teeth. Have cavities, iodine deficient. Have dry hair, dry skin, acne, brittle nails, you're iodine deficient. It aids with speech. I can attest to this one. I'm taking iodine, and I had been struggling with learning Spanish. Remember, right now I'm living in Mexico. And I just wasn't retaining it. It was very frustrating. But once I started taking the iodine, oh my gosh, everything clicked. My husband even said, "What have you changed? You are so much better than you were just a few days ago." And it had been a few days ago that I had started the iodine. So it also aids in the mental state, aids with cholesterol synthesis, carbohydrate absorption, helps with the conversion of carotene to vitamin A, also aids with the conversion of ribonucleic acids to protein, is a immune support mineral, kills abnormal cells floating around in the body. These would be cells of someone who already knows that they have cancer. Possibly they're in remission. There are still cancer cells floating around the body. So the iodine would help kill those cells. Aids with penetrate, let me start that over. It penetrates quickly through cell walls of microorganisms. These would be things that are making you sick. Okay, kills single cell organisms and aids with skin disinfecting. Okay, this is where you primarily see it used in hospitals. They rub that brown stuff on you. That's iodine tincture, and they're rubbing it on you because it's antiseptic. Okay, but that's not the only thing that it is. Iodine deficiency is related to muscle cramps, cold hands and feet. Think Raynaud's syndrome. Okay, Raynaud's syndrome is cold hands and feet. Proneness to weight gain. Ever lose weight and then regain it quickly? Poor memory, constipation, depression, headaches, edema. Malaise, overall weakness. You're just tired all the time. Dry skin, brittle nails, blood sugar imbalances, cancer, diabetes, heart disease, goiter, and so much more. Okay. What decreases iodine in the body? Well, we have bromide and bromine intake. You may be saying, "Oh, I'm not getting any of that." Well, it's used in commercial breads. We used to use iodine in commercial breads. It helps with the soft texture. And then they switched to bromide. I don't have a history there. I don't know why the switch was made. probably because the quote-unquote medical authorities came out and said that iodine was really bad for us. And so everybody started pulling iodine out of their processed foods. Then we have fluoride or fluorine intake. Of course, most of the U.S. Has fluoride in their water. Not consuming enough seafood. Now, there are logical reasons to not be consuming seafood right now. They're high in mercury. They're also high in radioactive iodine because of the things that have happened in Japan over the past few years. If you're not sure what I'm talking about, just do a Google search on Fukushima. Then also removing animal products from our daily intake is also a way of decreasing iodine in the body. How could taking a food out of our diet decrease the amount? Well, your body has stores. And remember, I said in the beginning of the class, your body does not make its own minerals, okay? But it's using them all the time. And iodine is one that it uses for all bodily functions. So if it's using them and you're not replacing them, your shelves, quote unquote, so to speak, are going to be empty or almost empty if you are not consuming iodine in some form. And again, remember I also said earlier that if it's not in our soil, then it's not in our food that we're eating. So we're going to have to take a pill or a liquid. There are liquid forms. Natural sources of iodine would be most of your seafood, unrefined sea salt, kelp and other seaweeds, fish broth, butter, pineapple, artichokes, asparagus, dark green leafy vegetables. But here's a note. Certain vegetables like cabbage and spinach can actually block iodine absorption when they are consumed raw or unfermented. Okay? So these are important things to think. Oh, I'm going to have this really large dark green leafy vegetable salad, and it's going to include some cabbage, and it's going to have some spinach, and it's going to have some wonderful leaf lettuce. It's going to have a few other vegetables in there. But the cabbage and the spinach is going to block whatever iodine is in that salad from reaching your body at the cellular level. Other natural sources are eggs, onions, mushrooms, green peppers, cantaloupe, strawberries, peanuts, and cheddar cheese. Thyroid hormones are essential for life as they regulate key biochemical reactions, especially protein synthesis and enzymatic activities in target organs such as are the developing brain, muscle, heart, pituitary, and kidney. Thus, iodine is critically important to the developing fetus. Oh, anybody pregnant? You need to have iodine. Wanting to get pregnant, planning on getting pregnant, you need to have iodine. Oh, here we go. This was one of my favorite quotes. This is from Dr. David Brownstein. And he says, of all the elements known so far to be essential for human health, iodine is the most misunderstood and the most feared. Yet iodine is the safest of all the essential trace elements, being the only one that can be administered safely for long periods of time to large numbers of patients in daily amounts as high as 100,000 times the RDA. Now, who is Dr. David Brownstein? Dr. David Brownstein is a medical doctor who uses nutritional medicines in his practice. Okay, he has clients who are diabetics when they come in. He puts them on iodine between 50 and 100 milligrams. And within 1 to 3 weeks, their blood sugar is balanced and they start naturally losing weight. Okay, that's how important iodine is. All right, so what are the RDAs? Here we go. The RDA for iodine, starting with an infant from 0 to 6 months, is 110 micrograms. Now, I just told you Dr. Brownstein is prescribing it in as high as 100 milligrams. Okay, this is 110 micrograms. This is like virtually nothing. Infants are from 7 to 12 months, 130 micrograms. Children from 1 to 8, 90 micrograms. So they're supposed to get less than their younger partners. Males and females, ages 9 to 13, 120 micrograms. From 14 to 18, 150 micrograms. Same is true for males and females 19 and older, 150 micrograms. Pregnancy, they recommend 220 micrograms, and lactation, 290 micrograms. So let me explain something to you here. Okay? The RDA is just enough to keep from becoming deficient in that nutrient. Okay? So the RDA for vitamin C is just enough to keep you from getting scurvy. And the RDA for iodine is just to stop goiter in the thyroid. But the problem is every cell of the body needs iodine. Remember, it's an essential mineral. When it is deficient, we see problems. When it is sufficient, everything's rosy and we see healthy people. Okay, so let's talk about it on an antibacterial form, because iodine is not just antiseptic. It is also antiviral, antibacterial, and antifungal. Okay, I'm telling you, this needs to be in our homes, period. Though iodine kills 90% of bacteria on the skin within 90 seconds, its use as an antibiotic has been ignored. Iodine exhibits activity against bacteria, molds, yeast, protozoa, and many viruses. Indeed, of all antiseptic preparations suitable for direct use on humans and animals and upon tissues, only iodine is capable of killing all classes of pathogens: gram-positive, gram-negative, mycobacteria, fungi, yeast, viruses, and protozoa. Why are we not cleaning with this stuff? That's what I've been thinking, other than the fact that it's brown. But you can now get clear iodine. You don't have to worry about it discoloring anything. Most bacteria are killed within 15 to 30 seconds of contact. Iodine is by far the best antibiotic, antiviral, and antiseptic of all time. This is from another medical doctor, Dr. David Derry. Okay? Now, Dr. Derry also says that iodine is effective for standard pathogens such as Staphylococcus, but it also has the broadest range of action, fewest side effects, and no development of bacteria resistance. Okay, so when we use iodine, we don't have to worry about the bacteria getting to a point where iodine no longer works on them. There is a world of difference between an antibiotic, which is an anti-life substance. It kills everything. It kills the good bacteria, it kills the bad bacteria. Okay? And an antibiotic, antiviral, and antifungal substance like iodine, which is life-serving because it is a basic and most necessary nutritional substance. Okay, so you got leaky gut, you have problems with your internal gut flora, you need iodine. Okay, you have an infection and they are recommending an antibiotic, you need iodine. Iodine offers a serious and potent replacement for much of the antibiotics that are literally destroying people's lives and can be used safely with children. Parents who choose not to dose their kids with dangerous vaccines, this is one of my favorites, will be glad to know that iodine can be very effective against a host of viral and bacterial infections that medical officials insist threaten children. Okay, so again, get the iodine in your home. I'm going to tell you exactly which ones that I recommend, but you can go to the first aid section and just keep that bottle of brown liquid in your house. And in an emergency, you can use that. If you don't have anything else, you want to cover everybody in that in case of like a radiation poisoning event. Iodine leaves human cells in better health and better gut flora intact. Okay? So it keeps that healthy gut flora intact. Because our body's real need for iodine are biological friends that inhibit our GI tract, these biological friends would have evolved in iodine's presence and thus be immune to the ruin that iodine brings to most single-cell life forms. Okay, so in other words, when we're taking iodine, iodine knows in your gut what the bad bacteria is versus the good bacteria. And it's only going to be able to wipe out the bad bacteria because the good bacteria has already experienced iodine. So you might say that the good bacteria is already resistant to it, and you want that good bacteria there. It's very important. Okay. So you might be wondering, how do I know if I am iodine deficient? And if I am, how iodine deficient am I? Well, again, remember, we're living in radioactive times. So all of us can consider ourselves deficient. We need to be taking more. According to Dr. Mark Circus, you can test your iodine levels by rubbing iodine tincture, preferably the brown and not the clear, on your inner thigh and check it every 30 minutes to see how long it stays there. Okay? The longer it stays, the less deficient you are of iodine. I read that and I went, wow, that's a concept. Had never thought about that. Okay? So again, remember, we are living in radioactive times, and iodine protects every cell of your body from radiation. Okay? Some people may say, well, I haven't had an x-ray in years. Well, but have you gone in for any type of diagnostic testing, a CAT scan, an ultrasound, sonogram? Those are all forms of radiation, okay? Okay. So we're going to talk about bromide detox symptoms, because what happens here when you start taking iodine is that the non-radioactive iodine pushes its way back into the cell. Okay, it has kind of like this. Think of him as a bouncer at a bar. Okay, he knows that he belongs there, but it also knows that bromide and fluoride do not belong there, so it's going to kick it out. When it kicks those things out, they linger around in our bloodstream, and they do eventually get eliminated. In the case of bromide detoxification, however, there are certain steps you need to take to help rush it out of your body, or it just keeps building up and building up and building up, and then you become very, very ill. And it has everything to do with bromide. Okay? So here's what detox symptoms look like. Eyelid twitching, foot twitching, tingling in the hands or feet, having dark thoughts such as suicidal thoughts, being depressed, there's no reason to get out of bed, kind of depressed, experiencing anxiety, emotionality. This would be, I'm really super happy and then I'm really super depressed. So it kind of presents like bipolar disease. Okay, but it's not, it's bromide. Okay. Mouth and tongue sores and cuts, or a quote-unquote sore mouth. You can't really pinpoint what the problem is. It just hurts. A different kind of acne. This is what we refer to as a bromide acne. It's acne-like eruptions without coniform. Okay, so coniform is when they come to that point. Some iodine users found taking zinc helps with the bromide acne. And we are going to talk about zinc. It's coming. You might also experience skin cuts, hair loss, brain fog, leg and hip ache. I've experienced this. I've experienced the eye twitching, a rash. Oh, my heavens. I had this really strange rash show up on the top of my head, right at my the part where I part my hair. And it was so tender to the touch. I couldn't brush. I couldn't comb my hair. It was soft. It was puffy. I could feel that it was swollen there. There was red bumps everywhere, and I used lavender essential oil, but I also took baths with sodium bicarbonate, which is baking soda, and that helped to clear it out. But I also did the internal saltwater bath, which I'm going to tell you about here in a few minutes. You may experience a metallic taste in your mouth. Sinus ache. Oh, that's what I've been experiencing this week. Oh, so much sinus stuff going on. And I just blow and blow and blow. Cherry angiomas, runny nose, headache, sedation, lethargy, odd swallowing sensation. So it kind of feels like there's something in your throat, but you can't swallow it. You can't cough it up, and it won't go down. Body odor. Okay, the bromos is Greek for stench. You just stink. Something awful. Unusual urine odor, dry mouth, ureteral spasms, frequent urination. So it kind of feels like you have a urinary tract infection that's not going away. This is bromide that's causing this. Diarrhea, constipation, vision changes, irritability, increased salivation, dream changes, hormone changes, kidney pain, breast tenderness. Okay, this may be transient symptom, and it resolves all on its own. Okay, for women in the childbearing years, breast tenderness can also mean pregnancy. So sometimes we panic when we have to think, okay, what am I doing? What have I added? Have I added something that is to support my thyroid? Because if I have, there is iodine in there. Okay, maybe not a lot, but there is iodine in there. Here are some bromide detox strategies. These are things that you can do to help your body release the bromide faster, but to also slow down that detox so that you have control over it. Salt loading. Okay, you may be thinking, but aren't we supposed to be on a low salt diet? Isn't salt bad for us? No, you want to do an internal saltwater bath, and again, I will explain that to you. You can stop iodine for 48 hours to rest your kidneys. This is a really good idea because all of this is going through your kidneys, and you don't want to adversely impact your kidneys while you're doing this. So perfectly okay to take your iodine from Monday to Friday and then take the weekend off. That's one of the things that I do. Reducing the iodine dose temporarily, then working back up. So let's say that you start at 12.5 milligrams and you work your way up to 50. And then you decide that you're going to take your 2 days off, and then you come back and you do 12.5. Okay? Taking several grams of vitamin C spread out throughout the day, along with iodine companion nutrients. Those are, this recommends 50 milligrams of iodorol, which is a supplement we'll talk about in a minute, 3,000 milligrams per day of vitamin C, 300 to 600 milligrams of magnesium oxide. And I do have on here in bold, see my presentation on magnesium, because I would point you to magnesium chloride and not magnesium oxide. There are multiple people who prefer magnesium glycinate or magnesium citrate, which you absolutely could do, but my presentation on magnesium, again, I specifically point you toward magnesium chloride because the body loves it the most, absorbs it the best, utilizes it the best. And in that presentation, I tell you how to determine how much you need every day. And you may need as much as 600 to 900 milligrams. So you want to watch that. 200 micrograms of selenium, 50 milligrams of niacin twice a day. Start lower to avoid the flush. So you want to start and build your way up to the 500 milligrams. 100 milligrams of vitamin B 3 times a day. And then from February 2008, Dr. Guy Abram cautions that excess calcium supplementation has been the most common cause of poor response to iodine supplementation. Okay, I don't even recommend that people supplement with calcium because it's in every vegetable. And if you're drinking milk, if you're eating dairy foods, cheese, yogurt, and the like, you're getting plenty of calcium. Okay, so we want to make sure that that balance is there. If calcium outweighs magnesium, you're going to have problems. So if you're taking a calcium supplement thinking that you need one, I would recommend stopping the calcium, starting with magnesium and with iodine. You also want to be drinking more water. Water aids your body in flushing all of the toxins out. And you need to be drinking and shoot for at least a gallon. A good rule of thumb is to take your weight, divide it in half, and that is the number of ounces of water your body needs at this current time. So if you weigh 300 pounds, you need 150 ounces of water every day, minimum. If you weigh 300 pounds and you're exercising, you're going to need more than that. Pulse dosing, this is the starting and the restarting of iodine therapy. So this is probably one of the only times when I'll tell you it's okay if you skip a dose. It's okay if you skip a few days, if you go a few weeks without it. Okay? All of this is helping your body do what it needs to do, but it's also supporting those kidneys. According to iodine users with skin symptoms, adding 25 milligrams of zinc often helps. Okay, and I wouldn't do less than that. Your body needs a minimum of 5 milligrams of zinc, but when we supplement it, it takes in less than the amount that we're supplementing. So with 25 milligrams, you might get 5 milligrams absorbed by the body. And the package will sometimes tell you, this is how much is in here and this is how much that should end up in your body, absorbed by your cells. Okay, these are the best supplemental sources of inorganic, non-radioactive iodine, and this is very important. You want to make sure that you are using non-radioactive iodine or you're shooting yourself in the foot and making things worse. We have Iodorol. Iodorol is the one that I take. It is a pill. It is 12.5 milligrams per tablet. Nisant and Lugol's iodine are both liquids. They are liquids that I would happily keep in my home. Again, I'm in Mexico. I can't get any of these here in Mexico. I have to make a trip to the U.S. to get them. But these are ones that I would happily use. The Iodorol tablets are the Lugol's iodine in tablet form. And they, like I said, they should be kept in the house. The liquids can be applied transdermally, so on your skin, as well as taken internally. So you'll understand in a few minutes why that might be important. So the Lugol's iodine solution, this was developed by a Dr. Lugol, and a lot of people feel that it's old-fashioned iodine. That's how some people refer to it. It was developed by a French physician, Jean Lugol. I assume would be in French, in 1829. It is transparent brown liquid consisting of 10 parts potassium iodide to 5 parts iodine to 85 parts of distilled water. It's an effective bactericide and fungicide, and in fact was for the better part of a century a common antiseptic. Okay. Though it has laboratory uses separate and apart from any medical application. So you may be familiar with this if you've done lab work. In the United States, Lugol's solution was previously unregulated and available over the counter as a general reagent, an antiseptic, a preservative, or as a medicament for human or veterinary application. However, effective August 1st, 2007, the department, well, the DEA now regulates Lugol's solution. And in fact, all iodine solutions containing greater than 2.2% iodine. Why would that be? Well, we have our favorite drug addicts to thank for that. It's now on a List 1 precursor because it may potentially be used in the illicit production of methamphetamine. So, this is one of those that you may be able to get it in one bottle, but don't think that you can go out to Amazon.com and be able to purchase 5 bottles at once. They may tell you that no, they can't do that. Okay. Now we have the Iodorol. And again, let me go back to the Lugol's iodine and make sure that you understand it is a liquid. So starting at 2.5 milligrams means you're using 2 drops. That's it. You drop 2 drops in your mouth or in some water and drink it, or in some juice and drink it. Or you can put it on the inside of your wrist where the veins are close to the surface, and it will sink in, be absorbed by the body. You can increase your dosage slowly, perhaps by, say, 2 drops weekly, up to 50 milligrams, 100 milligrams, or more. If you're going to do more than 100 milligrams, I really do advise you to find a medical doctor who is deemed, quote-unquote, iodine literate. And what that means is this is someone who's done the research and they know historically what the amounts have been. And historically, people have been given it in doses as high as 300 milligrams and even up to 1,000 milligrams. So it's not like it's going to kill you. But the more iodine that you're taking in, the faster the bromide detox is going to be. And you're going to need some help there. You want to make sure, again, that you're supporting those kidneys. Okay? Our class next week is going to be about sodium bicarbonate, which is a great way to support your kidneys. If you want to know more information about how to use sodium bicarbonate right now because you have your Iodine and you want to start it, or you've started iodine and you feel like death warmed over and you don't know what's wrong, contact me and I'll give you the information on using the sodium bicarbonate to aid those kidneys. You would have to do the internal saltwater bath daily, especially when a dose increase has occurred, okay? Because again, it's going to flood your bloodstream with more bromide. Pulse dosing is also recommended, and this one can be used transdermally. I have heard that it doesn't taste very good, which is why a lot of people will have it in their home to apply topically, but they're not going to drink it, okay? I haven't tried the Lugol's. I use the Iodine. So with Iodine, you start with 12.5 milligrams and you increase slowly, perhaps by 1 tablet a week. And by that I would say, okay, we start out with 1 tablet once a day. Now we're going to have 2 tablets, but we're going to take 1 tablet twice a day. And then when we're doing 3 tablets, we're going to do 1 tablet 3 times a day. So we're increasing the frequency of dose at the same time as increasing the number of tablets per day. You'll do the internal saltwater bath daily, especially when you have a dose increase, and the pulse dosing is recommended. Okay, so now we have the nascent. This is ideal for babies, children, as well as iodine-sensitive people and people who have pre-existing thyroid conditions. So if you're someone who knows that you're hypothyroid or you're hyperthyroid, this is the one for you. It is far more expensive than the other 2, but you use less because your body reacts to it better. It's in the atomic form of iodine, so your body doesn't have to break anything down like it does with the Iodine and the Lugol's solution. So with this, your body takes it in and immediately absorbs it and can use it. You do start slowly. 1 drop equals 400 micrograms. So 1 drop is already twice the RDA for iodine for an adult, more than twice, okay? 10 drops is 4 milligrams, 100 drops is 40 milligrams, okay? And you can increase up to 50, 100, or more. Internal saltwater bath daily, especially when a dose increase has occurred, and you can do the pulse dosing. Now this is one that Dr. Mark Circus has said that he uses with his children, and he's done as many as 25 drops 3 to 4 times a day when they're sick. If they start coughing, if they start with a fever, he goes for this. Okay? If they're showing symptoms of an ear infection, he goes for this. Okay? Don't underestimate this mineral. Just because our quote-unquote medical authorities have told us that it's a quote-unquote trace mineral, which we think is, oh, such a teeny tiny amount is needed, it turns out that that's true for the thyroid, but not for every cell of your body. Okay, so here's the internal saltwater bath. This is where you take 1/2 teaspoon of sea salt. Make sure that it is unrefined sea salt. Unrefined sea salt is not white. Okay, it's pink, it might be red, it's brown. Okay, white means that chlorine has been used to bleach it out. And you want to add the half teaspoon sea salt to a half cup warm to hot water. Mix well and drink. Okay, lots of us are used to doing a saltwater gargle for a sore throat. Well, this you're going to drink. Then you're going to follow with 12 to 16 ounces of clean water. And you repeat the entire process, salt water and all, there's another error, every 30 to 45 minutes or until you experience copious amounts of urine. Okay? You just keep going. You don't want to eat anything. You don't want to drink anything else until you experience these copious amounts of urine. Now, when you do this, your body will respond quickly because what's happening is the salt is binding with the bromide. And as you start to urinate, that bromide is being carried out through your urine. And you'll start to feel totally different. Okay? So I've had people contact me and they said, Angie, I've got this rash. And I asked them, okay, what are you doing for your thyroid? Because I know that's where people are thinking. Well, how did you know? I just started taking a thyroid medication. I said, okay, this is bromide. Here's what you need to do. And they go and they do it. And within an hour, they're contacting me, oh my gosh, the rash is almost completely gone. Yeah, because it's bromide. It's trying to come up through your pores, but you need it to go out through your urine. Okay? You can do a detox bath. I recommend these at least once a week while you're starting with your iodine until you know that you have sufficient amount in your cells. And we'll talk about what that means. I'll tell you here in just a minute. You want to add 1 cup sea salt, 1 cup baking soda, and 10 drops of Young Living's lavender essential oil to a tub of warm to hot water and relax for at least 20 minutes. Some of you may be thinking, do I have to use Young Living lavender essential oil? It's the only one that I recommend because I know that it is pure. I know that there aren't any impurities in there that are going to cause any chemical burns, I know that there aren't any chemicals that are going to cause a headache or a migraine or any other reaction. If you don't have Young Living's lavender, you don't want to get Young Living's lavender, you can leave it out and just do the sea salt and the baking soda. Perfectly okay. Some people will say, oh, but you could use Epsom salts instead of sea salt. No, use the sea salt. Here's why. Epsom salt is magnesium sulfate. That's it. Sea salt has around 80 different minerals within that sea salt. Okay? With the Epsom salts, your body is not responding to the magnesium, it's responding to the sulfur. And if you're somebody who already knows that you have problems with sulfur, you don't want to be using Epsom salts for that very reason. Sea salt, perfectly okay. All right. So, I said that I was going to tell you something, and now I don't remember what it was. Hopefully it will come back to me, or when I listen to this, I will remember. My sources were Staying Healthy with Nutrition by Elson Hawes. That's where I got the RDA information. This is probably the section in the book, the iodine section, that I can see that Dr. Hawes does not know what he needs to know about iodine. He's not someone that I would consider an iodine literate doctor. There's a lot of things that he needs to learn. But he gave me some really good information on what the mainstream thought is at this point. Iodine is not just about the thyroid. Iodine is about every cell of your body. And if you're not taking at least 12.5 milligrams daily, you're not getting what your body needs at a minimum level. And that's what I was going to share with you. What does it mean to be sufficient? Sufficient is that you have iodine as part of every cell of your body. When you start taking iodine, if you stay at 12.5 milligrams, it will take your body approximately 1 year to become sufficient in all cells. Okay, part of that is because your body does not absorb 100% of that 12.5 milligrams. It can only do so much. Okay? As you increase it, once you get to 50 milligrams every single day, and you would do that by taking 1 tablet of Iodirol 4 times a day, it takes your body 90 days to become iodine sufficient in all of the cells. Okay, so please, please, please don't think, okay, well, if I take 100 milligrams, then I'll be sufficient in 45 days. You have to remember the bromide detox. You have to remember that iodine is antifungal. And if you think that you have a yeast issue, you will experience a die-off in a very short period of time. You will feel like you have the flu. You will think that iodine made you sick. And it didn't make you sick. What it did was its job. It killed the overactive yeast to push it out of your body. And when you have a yeast die-off, it does feel like the flu. You have a headache that nothing will take care of, not even an essential oil. Okay? You have aches and pains, you're throwing up, have diarrhea. You just feel overall icky. You don't want to do an internal saltwater bath, but that is exactly what you need to help carry the bromide out of the system. And once all of the yeast die-off has left your system, you feel great. You look great. Okay? So take it slowly. Don't think that, well, I'm just going to start at 100. I would never advise anybody to start at 100. Always start at 12.5. And even Dr. Brownstein has some people start at 6. Okay? So we want to do this slowly. It's for the health of your body. Remember that. We have to support everything in your body and let them work slowly. So another resource is The Iodine Crisis by Lynn Farrow. This is a very good book. It leads you to the website breastcancerchoices.org. At breastcancerchoices.org, they provide you with a shop where you can buy the iodine, the magnesium, the vitamin C. And I have decided that that's who I would like to support. If I'm going to support anybody fighting against cancer, it's going to be an organization like this that is sharing information and letting people know, hey, you don't need the radiation, you don't need the chemotherapy. This is what you need. Your body needs this. Okay? Dr. Mark Circus was due at some point this year to release a book about natural chemotherapy, where he uses magnesium, iodine, sodium bicarbonate, and other minerals and nutrients to create a chemotherapy effect in the body that is actually healthy and healing. It's not killing anything except the cancer because of how it's helping the body to heal. Okay, so this brings us to the end of the presentation. And again, I do not charge for these classes because I believe that the information should be available to everyone. If you liked the class and feel that it has added value to your life, you can send a donation to me through PayPal at doctorofnaturalhealth@gmail.com. Just to give you an idea, if you were to hire me for one-to-one health coaching, I charge $1 a minute, so it's $60 an hour. I have a friend who I coached through some weight loss challenges she was experiencing, and I was working for another company, so she didn't have to pay me directly. She was paying the other company, and then they paid me. And I found out that she is a business coach, and she primarily works with the top-level executives of Fortune 500 companies. And she asked me one day, she said, Angie, if I was to hire you to do one-on-one health coaching with me, what would you charge? And I said, $60 an hour. It's $1 a minute. And she was silent for a minute. And I said, is that too much? And she said, no. She said, as a business coach, if I were your business coach, I would tell you to charge nothing than $150 an hour. Now, I don't do that. I will not do that. It felt good to hear. But as a doctor of natural health, I want everybody to have this information. I don't want people to have to pick and choose what workshops they're going to attend and what classes they're going to go to for financial reasons. I want people to watch this and then decide for themselves how much they would pay me for this information and send that to me. or hire me as your health coach. It is much easier for me to work with you one-on-one because a class like this, I can give general information, but I cannot tell you what you need and how we need to set things up for you. What would you start with, magnesium or iodine? Well, there are people who shouldn't start with magnesium. They should start with iodine. There are others who really need to start with iodine, magnesium, and sodium bicarbonate. But you don't know that if you're not working with me one-on-one. You're still kind of shooting in the dark. Okay, I have this information. I'm not sure how many sprays of the magnesium oil. She's already told me to start with 12.5 milligrams of the iodine, but I don't know if I need to go up to 50. So those are questions that we could answer one-on-one. So feel free to contact me, doctorofnaturalhealth@gmail.com, if you have any questions or if you'd like to hire me one-on-one as your health coach. Thanks again for coming. I appreciate it.